My name is Jeff Ryland, the host of the Parenting Tips podcast for parents of young and school-aged children. In this episode, we are going to be talking about something called the social determinants of health. This may seem like a word salad, but it really makes sense. You may find it helpful from a parenting perspective when you think about the various forces that both help and hinder your ability to parent well. The social determinants of health are not new. As early as the mid-1800s, almost 200 years ago, just as the Industrial Revolution was starting to gain momentum across the industrialized worlds of America and Europe, physicians were beginning to also notice an increase in poverty and disease. It was then that scientists began to wonder if health problems may also be created or caused by social influences. If you've been listening to this podcast from the beginning, I talked about our social inheritance in episode 4. Our social inheritance are the influences that children have no control over, the conditions they're born into, the quality and stability of their parental unit, and the family and environmental supports that are present from the moment they enter the world. They have no control over any of this, just as you had no control or say in the family or circumstances you were born into. That kind of thinking was part of the growing conversation over 100 years ago about the social determinants of health. So why does this matter? In the last episode, we talked about adverse childhood experiences, the specific things that kids are exposed to that may help us understand some of the mental health and physical health challenges they may face later in life. Looking at the social determinants of health is like zooming out from ACEs, what is going on in a child's family, to look more broadly at what is happening in the child's community. It's a 60,000-foot view rather than a close-up, and it makes sense to look at it from this perspective also. According to the Centers for Disease Control and the World Health Organization, social determinants of health are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age. There are 5 key areas to consider when looking at the social determinants of health. These are the non-medical factors that can influence our health and well-being. The first key area is economic stability. Economic stability is having what you need to provide for the basic needs of your family. Economic insecurity is the opposite. To be economically insecure means not having enough to get by, not having enough to pay rent, buy food, or cover other essential costs. Today in America, about 1 out of every 3 people live with economic insecurity. Statistics show that about 50% are people of color, minorities, about 30% are our elderly, about 45% are children, and about 40% are disabled. Those are pretty sobering numbers, and it makes me think about our rich nation. How rich are we, really? The great peace activist Mahatma Gandhi once said, "The true measure of any society can be found in how it treats its most vulnerable members." On some levels in the U.S., we shine. We can be charitable people. On other levels, we tend to look away. The second key area is educational access and quality. When people, adults and children, have access to high-quality education, amazing things happen. They are more likely to adopt healthier lifestyles, eat healthier foods, exercise more, and make better choices. They are more likely to have better mental health. They are more likely to live longer and be healthier. They are more likely to stay in school and have better access to higher-paying jobs. When people don't have access to high-quality education, especially children, they have difficulty mastering the basics of learning, reading, writing, and math, some of the essential life skills for a future when it comes to obtaining a good job. The third key area is healthcare access and quality. According to Healthy People 2030, about 1 in 10 people doesn't have health insurance. Without insurance, they are less likely to have a primary care provider or to afford medications. The ripple effects are potentially catastrophic, as uninsured people may not receive routine vaccinations or health screenings for things like colon cancer or diabetes. According to the CDC, about 4.2%, or about 3 million children, were uninsured in America in 2022. This number is down from previous years. When people don't have access to high-quality health care, including mental health services, things get worse. In healthcare, it is far easier and cheaper to prevent problems rather than to fix them when they are too advanced. The fourth key area is the neighborhood and built environment or community we live in. When you think about neighborhoods for children, a common question that comes up is it safe? Can my kids play outside or walk to the park a block away? Are there spaces for children to play? Is the quality of the housing, whether a rental or a home, of high quality? Is there access to healthy food, or is this neighborhood a food desert where the only foods available are from a convenience store? Are there ways to get around the neighborhood by bus, bicycle routes, or on foot? What kinds of industry, often a source of jobs, but also a source of pollution, are nearby? And what kinds of infrastructure, whether police and fire protection, sanitation, and building code regulations, help keep this a safe and healthy place for children to grow up? The built environment refers to the kinds of buildings and structures in the neighborhood. This includes roads. Are there safe crossings for roads? Or is the neighborhood divided by a freeway? Does traffic flow smoothly, or is it congested, leading to both noise and air pollution? Finally, the fifth key area is the social and community context. This last factor addresses the quality of the relationships we experience in our communities. Who are your people? How connected do you feel and your family feel to them? Do others feel welcomed in the community? Is the community accepting of differences, or is there discrimination? Are there outlets for engagement and volunteerism for services to others? Are there churches, mosques, synagogues, clubs, recreational facilities, and other places in the community that can bring people together? Or do people seem to live in isolation, not know or speak to their neighbors, not lend a helping hand when needed, and generally feel disconnected from others? Social determinants of health have a major impact on people's health, well-being, and quality of life. Examples of social determinants of health include the availability of safe housing, transportation, and living in safe neighborhoods, the presence or absence of racism, discrimination, and violence, the quality of education, job opportunities, and a stable income, access to nutritious foods and physical activity and recreational opportunities, the presence or absence of clean air and water, the degree to which people within a community feel welcomed and valued versus shunned and discriminated against. When we are aware of the social determinants of health, we can more easily see health disparities among different groups. These 5 areas, all non-medical, each contribute to the health and well-being of each member of the community. It may seem like a monumental challenge for a parent to assess each of these 5 things in their own lives and how this may affect their children. I mean, why bother? These things cannot be changed by just one individual. But that is the point of even talking about the social determinants of health. It is not up to just one individual, just one parent. It is up to all of us. It is up to government, healthcare, business, and educational institutions to do something about the data regarding social determinants of health. This data can create awareness, spark activism, and action for change in any of the areas we discussed: safe neighborhoods, better access to housing and food, better access to high-quality education and healthcare, and improved social connections free of discrimination based on differences. Research also supports that parenting practices are influenced by the social determinants of health. Living in a stressful environment is not resource-rich with opportunities for children and parents alike, and it will make the hard work of parenting even harder. I know that change at the societal level can be slow, and sometimes movements really seem invisible, but change is inevitable. We know that we are only as great as the smallest among us. We are measured as a society by how we treat our most vulnerable members. We are learning that for some of us to truly succeed, then we have to make it possible for all to succeed. Change and progress can be measured in the tiniest of moments and movements. The reason this podcast exists is because I work for a healthcare system that has allowed me the time and resources to make this valuable parenting knowledge available at no cost to you. Knowledge is power. When we know better, we do better. For this, I am grateful. For more information on the social determinants of health, there is a great fact sheet by the University of Illinois, Chicago, available in both English and Spanish. You can find the link to this in the show notes. Thank you for tuning in and considering this parenting topic. I hope this information has added to your growing toolbox for parenting your child or children. Please consider exploring other topics in this series. Remember, no one parenting tool can do everything. We need many tools to become the best parents for our children. Your children's future depends on you and the time and effort you invest in them today.